For severe cases of pneumonia where patients have to be hospitalized, they may need both IV antibiotic therapies, and in the event that they have a fluid collection develop as a result of the pneumonia, they may need drainage of that fluid. The main cornerstone of therapy for pneumonia is antibiotics. Most pneumonias are caused by bacterial infections of the lungs, and antibiotics will treat those infections. Most patients can be treated with oral antibiotics and returned to their home for treatment. In some extreme cases, patients may need to be admitted to the hospital to get IV antibiotics to treat the infection. Other than the antibiotics, some patients need medications to help them bring up the secretions from deep in their airways. This can be anything from inhaled therapies to some mechanical therapies as well, such as vibrating devices. If patients have high fevers, we would give things to bring down the fever, such as Tylenol or ibuprofen. For severe cases of pneumonia where patients have to be hospitalized, they may need both IV antibiotic therapies, and in the event that they have a fluid collection develop as a result of the pneumonia, they may need drainage of that fluid. This can be done by a simple procedure called a thoracentesis, where a thin tube is placed and can drain the fluid around the lungs. Or in cases where that fluid appears to be infected, a chest tube can be placed to also drain the infection as well. In patients who have difficult to treat pneumonias that aren't responding to therapies, it may be necessary to perform a bronchoscopy. A bronchoscopy is a procedure where a camera is placed down into the airways and a segment of the lungs is washed and biopsied to determine the cause of the infection.